Hi, I'm Dr. Iresh Shetty. I am a consultant cardiothoracic and vascular surgeon at KMC Hospital, Mangalore. So, cardiac surgery for the elderly is quite common because most of our patients, especially with coronary artery disease, are aged 60 and above. In this case, we have to first assess the patients pre-operatively before we go ahead for cardiac surgery. Even though our initial investigations, including a coronary angiogram, suggest that we need to undergo surgery for these patients, they still have to be assessed to see if they are amenable for the same. In these assessments, we check initially the risk factors that the patients have, which include comorbidities. Comorbidities including diabetes, hypertension, bronchial asthma, or tuberculosis, or anything like that. If any of these comorbidities are there prior to surgery, they have to be first optimized to a level wherein they can tolerate surgery afterwards. Other than this, we will check the respiratory function, which is basically the lungs. So the lungs are very important as well in cardiac surgery, especially in the elderly, as after cardiac surgery, our patients undergo something called as chest physiotherapy, which is required to cough and take out sputum. So if the patient's lungs are bad before surgery itself, they have to be assessed and optimized properly before we undergo further surgery. So most of our elderly patients are assessed for this, and as well as the other comorbidities that I spoke about. Another important thing that we have to assess in these patients is their neurological evaluation. Certain stroke in the future, and they have to be assessed accordingly for the same. To do this, we assess the carotid vessels, which are the vessels arising from the heart that go to the brain, and we have to see if there are significant blockages in these vessels as well. If there are, these have to be tackled with either before undergoing cardiac surgery, during cardiac surgery, which is called a concomitant procedure. If in case these are not dealt with before we go ahead for surgery, there is a high risk of such patients undergoing something that we call as a stroke or an attack to the brain. So these have to be assessed prior to surgery to make sure that our patients do well following surgery. And this is quite commonly done. Once assessed, cardiac surgery is safe even for the elderly post 60 to 70 years of age.